got two Stephanie Christners.
They look
For
identical.
some reason, I don't know what's going on.
What is going on? You got connection. Which one is the real
So there's one.
Well, the real Stephanie Christner.
And there's two. Look at that.
Which one do we use?
I don't.
Okay, now let's all right. Let's take one out of the.
Get rid of one of them.
Again, Dr. Christner.
Hi, Stephanie.
Hi.
It's working. Okay. All right. We're good.
Hallelujah. Good. Thank you for connecting. And I'm sorry we didn't get the test in advance. This is the hard part of our show, is that we don't have a team of 12 Clydesdales. We've got Super Don, and he's amazing as he is.
I'm at least 3 Clydesdales.
3 Clydesdales. He's pretty good. It's pretty good. Right. So, Dr. Christner, we're connecting with you through our friend Babry Oren, who has developed or helped brought over here to America the Folium products, the Folium PX. And I just want to, maybe you can introduce yourself to the audience, let us know what you're all about, and maybe if you want to comment on anything you've seen or heard so far, because it's been pretty profound with the stuff we've been covering.
Okay, am I still on?
Yes.
Okay, because it said I was removed, so I'm new to this as well. My background's in family medicine and psychiatry, and I'm currently involved in creating a franchise network of kind of a new paradigm of mental health clinics that also focuses on performance as well. We utilize neurofeedback, and we combine photobiomodulation, really focusing on the gut to decrease the inflammatory process in the body, which contributes to so much inflammation in the hypothalamic pituitary axis. And we really feel if you don't clear the parasites, the viruses, the bacteria, correct the microbiome, that your mental health and physical condition won't improve. So that is our focus. We have a location in Oklahoma and just opened our first franchise in Charlotte, North Carolina.
Oh, wow.
So, yeah, I have fun doing that. I, like you guys, are concerned about the environment and the effect on every bodily system. And so that's our focus.
Dr. Christner, as a psychiatrist, you know that the field of psychiatry has gone off the deep end in terms of pharmacology, despite having no analysis in the DSM. When we talk about psychiatric disorders, there's no blood test, there's no hair test, there's no, saliva test, stool, all of these things that you would say objective tests to analyze and say, hey, yeah, this is a candidate for this particular drug because it replenishes somehow that chemical imbalance that we claim that we see, but we don't have any evidence of.
That's exactly it. And that's actually why I love Babry's products, Folium, because, for centuries, we know that plants and herbs have phytochemicals in them and metabolites that address what a synthetic pharmaceutical product tries to address, but they only target one component, where this is when you combine all the plants and herbs together, you really get a synergistic mechanism that is targeting the root of the problem.
Mm-hmm. Yeah, and these things are multifactorial. I don't think it's just one thing. We can talk about heavy metal contamination being impactful on the brain nervous system and the gut, brain axis points. And that's legitimate and real, but is that the only thing? Then we come into the glyphosate impacting the epithelial lining of the gut and also being an antibiotic in its own right. So there are so many factors that it makes it very complex, but if we ignore those base level complexities, we'll never get to the things that are, troubling them even in a mental and emotional state that are made worse. Maybe they are actually there, but they are certainly not made better by having a physiology that is so corrupted.
That's exactly it. And that's actually exactly our model at Renew You. It's a progressive process that takes place, starting with anxiety and disruption of the hypothalamic pituitary axis. And if you can't revert back to a state of hormesis, then you're going to progress along to not only mental health problems, but also autoimmune disorders, diabetes, and eventually dementia. And so without addressing the underlying factors, which you've just stated so well, there's really no hope of regaining your health.
Have you encountered any opposition from within your profession, licensure board, et cetera? Because we've talked about the practice of medicine for decades here and how they can't define standard of care, but they know it when they don't see it or something. And they don't like it if you do these innovative nutritional, approaches, detoxification approaches that don't involve drugging people out of their minds.
Definitely. I've been doing this for so long now. I actually had, saw my own children hurt by the vaccination program, which really opened my eyes so many years ago. And so I've been off in my own little world working away. And yes, my peers wonder what I do. And they know I just don't write prescriptions. But no, I've not been targeted by the board or anything like that. I've been very fortunate for that.
Well, I pray that that continues for you. And as I mentioned in the first hour, I've seen a lot of physicians change their views and become open-minded where they weren't before because of what we've been through in COVID. Have you encountered any of your colleagues now looking at you and going, "Oh, maybe you were onto something"?
Absolutely. That's been a huge factor, a huge wake-up factor. And that is the silver lining of COVID, is so many people's eyes have been opened, including consumers. Now are looking for alternative ways and want to gain a better understanding of really what's going on.
Yeah. So how did you connect with our friend Babry Oren and the Folium products, the Folium PX? Was it at a medical event of some kind?
I think it was online through United News Network. I saw his products on there, and we're looking to utilize the best products on the market. And so that's really where we initially connected.
Yeah, I'm curious. I told Babry, I said, I want to talk to doctors that are working with the Folium because I've seen such extraordinary things with my own mother at 89 years of age. She had a rough time through COVID, although never officially diagnosed with COVID, but a lot of strange maladies, skin issues, etc. And finally got her on Babry's the Folium. And within a couple of weeks, she called me, says, "I'm sleeping better. I'm getting more energy right away in 2 weeks." And that was when she was 88. And I said this at 89. Well, now on her birthday, she was dancing again, but she was dancing on January 1st to celebrate the new year. So significant endorsement from me, helping mom the way that he has, or that Folium has. And then more recently, we interviewed a physician who worked with a mother and a daughter. The daughter was harmed in the early preteen teen years with the HPV shot vaccine, and
Yes.
had gone through years of trouble and struggle, and eventually got the Folium and is back to work doing fully functional. I mean, she's doing great. It was, again, another wonderful, uplifting story.
It truly is. I'm a big researcher, so I really like to understand how each ingredient targets a different pathway. And I have been so impressed with each product, and that combining, you can't create a synthetic product that addresses all the molecular pathways that detoxifies metals while also addressing radiation issues, viruses, bacteria, the inflammatory cytokines. It's truly miraculous, in my opinion, as well as, I mean, there's so many studies showing how all these individual phytonutrients will increase the diversity of the microbiome. And you can't beat these products.
I actually covered a story yesterday that was like right in Folium's wheelhouse. There was a study that came out that showed that if a child basically under 18 got more than 3 CT CAT scans in their life, that they had double the risk of certain cancers. So double. I mean, that's like not a percentage, a doubling of the risk. And I said this for those of you who are adults that get CT scans semi-regularly or just get them whenever a doctor says. If it's doubling a child, it's not going to be that much better for you as an adult. And we have to counter as well the ionizing radiation, the damage, and the chromosomal damage that manifest as cancers later in life or currently.
It's amazing. It's just so additive from day one. Once you are born onto planet Earth, you're exposed to an ungodly amount of toxins repetitively. You can't escape it. And so you've got to take protective action through things like Folium, as well as we need to clean up planet Earth.
Yes, we do. And that's part of our mission here. So I have 3 products here. I want you to talk me through how you've worked with your patients or clients in integrating the Folium with other things or on their own. The Folium PX, this first one is called the Super Antioxidant. That's the baseline to start with. And then my mom also got on the Folium Immuno, which is the second in the phase that I see here. And then the Folium Relax, which, I mean, we could all use a little bit of that. So talk to me about how you've integrated it.
Well, I integrate it very similar. I start with the Folium PX to decrease the overall oxidative stress that's damaging the cellular membranes and allows the cascade to take place. And the PX also will stimulate our own endogenous detoxification pathways. So I start there, and then the next month I will add in immuno and relax at the same time. I particularly love relax because it does really address the hypothalamic pituitary axis, which involves the vagus nerve, communicating with the gut, and even lung issues. There's a lot of gut lung brain interactions as well as gut brain, and so if we can correct that signaling, we often are. This is what I do see, is I do see people begin to revert back to a state of health. It does take time. It does take time. And I combine that with neurofeedback as well as the photobiomodulation. I'm sure you've heard of Bale's photonics. We're using that in combination with the neurofeedback, and we are getting extreme results.
So if we're putting, like, let's just say we're starting a patient in the first month, and I know this is a generalization, so I'm not saying I'm locking you down to this, but in a general sense, we know the safety of the product because these are botanicals. And the average adult, are you suggesting 2 capsules 3 times a day, one a day to ease into it? What have you found is the most beneficial, or is it just radically different for each patient?
Well, it is different for each patient, for sure. If I don't think it's going to trigger too much detox, I will quickly increase the dose to 2-3 times a day.
Okay.
On the PX.
So you're
when I start.
sensitive to what I'm sensitive to as well. It's like, we know that they're carrying a burden. We know that this will help counteract that and help facilitate the elimination of it. But there's a general, let's say, adaptation time frame that if you accelerate too quickly, the patient might not understand what's happening, might not be comfortable. And this is a classic case of, we call it a HERX or a healing crisis or aggravation. It's not because you're adding toxins to the body. In fact, it's quite the opposite. So like, we're removing it, and it can be so fast that some people are like, that's too quick for me. But on average, if you start with 1 a day, you can build up. If you want to go gradual, as you pointed out, if you don't suspect that's a concern, you can move right into the 2-3 times a day and really move this thing out faster.
Absolutely. And I'll add a binder when I really expect to see a high toxic load or a die-off reaction. And patient education is huge because in the mainstream world, we're taught that if you have a rash or flu-like symptoms, that, oh, you must be sick. And so we really focus on educating the patient about what to expect.
Great. And so how many months, or has it been a year or two? I feel like I'm catching up now on the Folium products. I'm so excited every time I talk to a doctor that's integrating them and able to share what you're seeing.
Yeah, it's probably been 8 months since I started using the products. Probably about 8 months. And it really takes out having to jump around to other companies and looking for the right thing because of all the various ingredients in there. And so it's nice to be able to stick with one company, and a company that's certainly done their homework, and it's an extremely high quality product.
There's questions that I have about aggressive intravenous type chelation for heavy metals as such. And I think, to me, that's a last resort, but I understand it's a response to unusual or inordinate amounts of toxic burden. Initially, that was a lead toxicity issue that began the IV chelation in the mid-20th century, that eventually it became called quackery because it found out that they were clearing the arteries of patients, and they couldn't have that because it would stop the development of open heart surgery, which became a multi-billion-dollar industry. But as far as your sense of the efficacy or your visual, response that you see these patients, could we expect similar profound impacts in terms of countering the oxidative stress that could affect the vascular system positively without going invasive?
Absolutely, 100%, because that's a progressive process as well, where you eventually get the endothelial damage by not turning off the vicious inflammatory cycle, for sure.
Yeah, great. Thanks for confirming that for me. By the way, your website, let me see if I have it up here correctly. Dr. Christner, CHRISTNER.com.
That's a little just landing page of
Okay.
mine. The company website, we're actually owned by a publicly traded company called Paragon X.
Okay.
It was initially named Live to Be Happy. I'm not sure if they've officially changed that on the website yet. And then renewyou.com is the franchises that we're creating.
Renewyou.com. Okay. And you're part of that setup, right? You're helping to facilitate that.
Yes, exactly.
Okay. Now, if I go to renewyou.com, RENEWU, I'm not opening it. Maybe there's another way to spell it.
Well, it's split right now. We have renewyou.tulsa.com, and then there's a Charlotte. And so we're actually in the process of creating a new site right now.
Okay, gotcha. All right. Well, I just wanted to make sure people can find you if they need you. And now I'm gonna risk it by bringing in my good friend Babry Oren, and he didn't get the test, and I know his fun with internet. Babry, how are you, my friend?
Can you hear me?
Yes, I can hear you. Of course, you're vertical instead of horizontal. I don't know why that is.
By the way, that's the way I sleep.
That's the way you sleep, in vertical position. We got to talk to you about your sleep habits, Babry. So you connected with.
Just kidding.
I know. Thank you for connecting us with another awesome doctor, and Stephanie Christner, and her willingness to share. Because this is, as I told you, Babry, this is part of my journey in wanting to understand more about how to integrate this into the serious issues that are out there for folks. And I'm not saying everybody needs to go see a Dr. Christner, but it's great to know that there are people like her out there to help along the way. And also, I love that we can actually access the Folium for those that don't have access to this directly, and they could try this and kind of given a semblance of how to start. Everybody's different, and sometimes you have to do it intuitively.
Well, we're here. We have the product. We have help is here, which whatever extent, and all the rest of it is up to the person that needs. You cannot force them to do anything. You can only advise them what it is. You can only present it to them, and then decision is theirs. You see, here's the bottom line. We all have rights to be healthy. We also have the rights to be sick. We also have the rights to choose. And all the rest of it is up to the people themselves.
Well, as you know, Babry, there are entities out there that don't want us to have the freedom to choose. That's what we've come through the last 3 years in particular, where many physicians were targeted because they were actually helping and not doing what the so-called government mandates told them that they had to do. And God bless them for standing up and doing the right thing, but they've been attacked for it. And you have been working for years, as far as I know, to communicate and educate to the best of your ability with the scientific journals out of the Ukraine that have shown the scientific validity of this formulation and what it's doing. And again, for those of you that enjoy the science of it as much as I do, I also love to hear the clinical response, which is why getting these doctors on like Dr. Christner is so helpful.
Well, when it comes to freedom, excuse me, I can only tell you about myself. I bet the Soviet government at whatever price, and American government seems to me like peanuts. It's nothing. We can beat them easy. Anybody who goes against freedom, they're committing themselves suicides. Believe me, because freedom has no substitute.
Well, and you speak from experience, having existed under the Soviet Union, communist, totalitarian type dictatorship, and many people have not lived under that. Those that have come to America and warn us about the direction, every time we move away from freedom, how dangerous that is. Yet, because we have taken freedom for granted in America, many Americans don't appreciate what you're saying.
Well, they cannot, because they have never lived how they never had to fight for it. Like if you go back to the American history, what the Americans fathers have done to get what we have. If you do not appreciate it, if you do not keep it, here's the thing: use it or lose it. And they're losing it. It's unfortunate, but that's the reality.
Yes.
but my freedom is my own, and it's not for sale.
Beautiful. But the Folium product is, everybody should buy some in freedom, not coercion or deception. That's why I love doing what we do, because giving this information provides an ability to make better choices. And Dr. Christner, of course, you as a physician, you kind of know about what Babry's mentioning, because there's been a lot of limitation of your freedom, or attempts to limit the doctor's freedom to basically innovate and respond to the needs of the patient based on a collectivist ideology that everybody gets the same thing, whether it be a shot or a drug, which is absurd.
That's absolutely correct. And I even think we have a false sense of security here in America, because, and in some other countries that are not as progressive in the mainstream medical realm, I almost view them as having more freedom of healthcare, because doctors are educated here not really in what is the cause of disease in medical schools and things like that. So we have a false sense of security when someone goes and sees a mainstream physician. So I really see our biggest hurdle is re-educating the public about what causes disease and how to prevent and reverse it, which is not through a pharmaceutical product. It's through products like Folium. And there's plenty of them. And it's really going to be fun to see what happens over the coming years with the studies that Folium is doing, and to really have evidence of how to revert disease and not progress along the illness spectrum.
Dr. Christner, are you able to share, obviously with no names because we're not HIPAA violating here, but just in general, some things that you've seen since you've integrated the Folium into your practice in the patient population?
Yes. This is not in our franchise model, but I see private patients. And so I can track and monitor what they're excreting in their urine and what their toxic load is chemical wise as well. And it takes some time, but it happens. And people will come to me because they know I will provide them with products that finally get at the root of what is going on. And we'll track it based on laboratory evidence. And that I've seen that with the Folium products.
Nice. Nice. Now, when you first saw Babry, or it was, you said it was online, was he doing an interview online, or was it like an advertisement of some kind online?
I think it was on Telegram, on the UNN channel on Telegram.
Oh,
and
okay.
so we started communicating there. And then as I learned more about the products, then we started communicating a lot.
Nice. And I teased Babry about his Ukrainian English, but I'm getting better at understanding him.
I agree. I agree.
Leave Ukraine alone. I'm Georgian. Come on.
Okay.
Right. Yeah.
Anyway, we love Babry. And again, he's dedicated his life to get this out. I know it's your mission, my friend. And I'm glad we can help in any small way, but I'm encouraging you all to consider what I've been saying about it for a while now, the experiences my mother has had and others that we've introduced to you on the show. And Babry, you're going to Washington, D.C. this weekend for a meeting. I was hoping you were going to be in Nashville for the event, but apparently you've got another meeting you have to go to.
Well, not only that, but I did not take very seriously to get my table and all that, and it was already taken. It's a great show, but I will be there I will be on that show for that show in Vegas in a couple of months.
Okay, is this the one I was telling you about, the Biomed Expo that I'll be at?
Yeah, right.
Okay, good. Yeah, and that's coming up in Las Vegas, September 14th through 17th. And I'm encouraging folks to consider attending that with us. Or if you have you want to give a presentation, I don't know, Dr. Christner, do you do ever presentations at conferences?
I attended.
Robert, she did presentation on our behalf. You forgot maybe. At
No.
Expo.
At the Red Pill.
Was I there? Yeah, I was there, but I was emceeing. It was too much to remember everything.
Yes, you were busy. Very busy.
I need to get on the Folium right away, Babry. I mean, this is ridiculous.
Will not hurt.
So I look, this has been something that I have been on a pace like you would you might believe, hitting show after show after show and presenting. It's like we've been shut down for the most part in the 3 years of COVID. That this year has been like explosion of activity. And even the latter part of last year, we were hitting a lot of events simultaneous to that. So since you were already there, I was thinking maybe we get you to present in that Las Vegas event. I was thinking out loud in that regard.
Well,
I think that'd be great.
Well, we will be here. We will have Cancer Control Society convention here in Los Angeles, in Glendale.
Oh, wonderful.
I hope you will be there too, because it's a great show.
Yeah, I haven't talked to them about that this year, but if it's going on, it's something that certainly I've enjoyed over the many years. I've been to a number of them, and then I know that it moved, and there's a whole lot going on there. But Frank Cousineau has been a friend for many years, and I hope it succeeds because it's done decades of good work. I mean, over 40 years they've been meeting.
That's where I met you first time.
That's right. Yeah, that's right, at that event. So again, you guys are pushing my memory envelope beyond belief. I don't know if I could stretch that far. Super Don, you say there's a question coming in one of the chat rooms. Okay. Donnie Malkin. Okay. What is the source of Folium? Babry, you want to answer that?
Yes, I can. The initial PX, the source is pine parts and grapeseed extract. No, there are some other elements which we will not disclose.
Mm-hmm.
And that are what makes this product what it is. But major ingredients are Folium, pine parts, and grapeseed extract. Now, PX, that's what stands for, pine extract.
Yeah, needles, bark, and cone, and the grapeseed extract. And these are already profoundly known to do wonderful things metabolically. And again, the binding, the antioxidant capacity, the anti-radiation capacity, all of that is present. And I think the way it's been put together is quite unique. I mean, there are people that have tried to do little isolates of this stuff, but this is a whole product.
Yeah, but you have to, Robert, we spoke about it before. It's not what's in it, but how they are
combined.
Proportion. You see, you have to know what the proportion is. Let me give you an example. If I gave you H and I gave you O, hydrogen and oxygen, make me a water. If you don't do 2 H's and 1 O, you will never have a water.
Right.
So you have to know what the formula is. And that took many years of studies and working and retesting and all that, and finally it's done.
Yeah.
That's for PX.
Well, and to your point, Babry, in that regard, you can see and hear about these ingredients and they're known. But as you said, the way it's put together proportionally, et cetera, is very unique and very well studied. That's what makes this so unique in its clinical application and why doctors like Dr. Christner are using it and having great success, in addition to what happened for my mom. After doing a lot of great things that I know to help her with, that product, the Folium products that we put her on, have been the next level. It took her to the next level where even all that I know was getting her to a point, and it's like, wait, why isn't this getting on? And then the Folium came in. It was like, that's the miracle we were looking for.
Now, the other, yeah, go ahead. Go ahead.
I was just going to say about mitochondrial health and the hypoxia, or the lack of oxygen that occurs, and the lack of energy, which is so key to overall disease today. And again, all the different ingredients in Folium target different various pathways within all of the cellular mechanisms and protect the mitochondria and help revert them back to a state of health. So we do have bioenergetic connections.
Mm-hmm.
Okay, that's related to Folium PX. But the other products like Immuno, it has a dozen of ingredients, maybe more. And all it took so many years of testing, retesting, and refining, and all that stuff, which was hard work and very long and very painful. Because you see, there are some ingredients they do have some common elements in it. If you don't do it in a right proportion, then one can kick the other one out and damage more than help.
Mm-hmm.
And so is Folium Relax. And we got it done. It took many years, but it was worth it, believe me, because we're having every single day so many phone calls coming in just to say thank you for helping them.
Beautiful. Well, I'm loving it. I love the empowerment. I love the success that's occurring. And it's just like anything, as I told you, Babry, when we first connected about this, you hear it again, you hear it again. And then the 10th time, the 50th time, suddenly you hear it for the first time. It's like, oh, that's what they were talking about. And that's why, again, I'm grateful, Dr. Christner, that you came on, because you're helping the communication in different ways. You have a unique way about you to bring that to light. And it triggers certain thoughts in people in a different way, and it's very helpful. So I appreciate that, and I hope to see you again at another event, maybe the Vegas event or an otherwise. And I apologize, like I said, I've just all the things that I've been to, they've become a blur. So many of these events that I'm embarrassed, but I can't remember everything.
I certainly appreciate you stepping out and doing that and making that your life mission.
Yeah, it does bring a smile to my face to be able to bring the power to heal back where it belongs. And that's with each and every one of you. And Babry is helping to do that as well, my friend. Babry, now, is the RSB 10 code still effective for people if they want to go directly to you?
Absolutely.
Okay. Want to make sure you're taking care of the family here.
You see, Robert, the thing is about what you were just speaking just now. In this thing, we are not isolated. We are together. It's not you or me. It's you and me and Stephanie and everybody else who cares. And then more people care than don't. You know what I mean?
Mhm.
And all we have to do is to unite, and we beat them.
Yeah. Well, it's good. It's coming together. It's like a reunion. That's why we're going to have that RSB family union in July at Leslie's place in Southwest Missouri, for all of y'all that haven't checked out the upcoming events tab at robertscottbell.com. And we've got a bunch coming up. Y'all check it out. And if you're not already subscribed to the show newsletter, you can text my initials, text RSB to 22828, text RSB, my initials, to the number 22828. And you'll be prompted to enter your email address so you can get plugged in. And Super Don sending out the blasts on the different things that we get to do together, both online and on location. As RSB, text to the number 22828. All right, Babry, is there anything we forgot to share today, or Stephanie?
I don't think so.
Well, you know what? The thing is, Robert, I want to emphasize not only toxic heavy metals, but also these products, they do help. Proven and documented, you have interviewed them, to the victims of vaccination. And that's a big thing today, because all over the world, so many millions and billions of people have been vaccinated, and many of them got hurt, could not take it. Some of them even die, and these products can help many of them. You have interviewed some of those people yourself.
Mm-hmm.
Okay, not only that, it also helps people with the residuals of the viruses.
Well, this is why I wanted to bring up that issue with Dr. Christner about IV chelation. It's an aggressive kind of binding, detoxing support, if you will, in an unusual circumstance. But as I'm hearing more about, particularly when we talk to the mother-daughter, what were their names again, Babry, that we had on? She was harmed by the HPV shot many years ago.
Chloe Reynoso, Michelle Reynoso is his mother.
Yes. And how she was given an opportunity to go, well, you can try this IV chelation or you can try the Folium. And she said, oh, I think I want to go to the Folium. And it worked. It helped her. So that's the great news, that even though I know there's a place for those invasive therapies that are not truly fully natural, but I acknowledge the place for them in certain circumstances, the more I can find ways to not have to even resort to that, the happier I am, because it makes it more accessible and much more affordable for people to get well.
I agree.
Yeah, go ahead.
Well, with just chelation, you certainly miss out on all the other benefits of the Folium products, which natural antidepressant, natural anti-anxiety. You miss out on studies showing increasing diversity of the microbiome and different neurodegenerative conditions and things like that. So So chelation is, again, almost just like a single targeted approach.
Right. Exactly. Beautifully
Also,
said.
I'd like to make clear something here for disclaimer.
Yeah.
Our products, none of them heals anybody or treats anybody in any way, shape, or form. What they do is they help the body to heal itself.
Correct.
Because there is something in our body. Every time you take a breath, you're hurting yourself because air is polluted. We know that. And when they accumulate a lot, then problems start. But these products will get rid of them, most of them, whatever they can do, and it's easier to fight the problems.
Beautiful. Babry, if people want to call you to ask questions and get some answers, is there a best number to reach you? Or if I just send them to the Folium PX website, will they have a number that will work to get you?
Well, they can call 818-996-HEALTH.
818-996-HEALTH?
Yeah, or 818-996-HEAL, HEAL, or 818-996-4325.
Okay, because that's a different number than what's on the top of your website, just so you know.
Well, on the top on the website, that's for to take the orders.
Okay, for ordering. So,
If they call them, just leave the message. We'll call them right away. So we have lots of people are calling with questions, and we are noticed immediately, and we call them immediately.
okay. Thank you, Babry, for following up on that. I appreciate it.
You're welcome.
All right. Dr. Christner, hope to see you at an event coming up soon.
I do too. Thank you. It's very nice to be here today.
Yeah, thank you both for being on. Big hugs to you both, and I appreciate you. That's the fun I get to do here, to bring good people that are doing good things, good works, to facilitate that power to heal. As Babry said, it's not that the products are healing you or curing you. It's helping your body to do what by God it's designed to do, giving the body what it needs to accomplish that. So again, thanks to Dr. Christner, thanks to Babry for being on board today.